Satish. Rajay. Good evening, dear doctors. I am Dr. Shilpa. It's a matter of pride and privilege to introduce my own dear friend, Dr. Chiranth. We all know him as a very joyful person, a very helpful person to a needy anytime. So, and I'm very happy. We did our graduation together in Government Homeopathy Medical College and Hospital, Bangalore. He also did his post-graduation in practice of medicine from the same college. He has done his postgraduate diploma from International Academy of Classical Homeopathy, Greece, under Professor George Vitolkas. He's the director of Srushti Homeo Clinic, Nelmangla. He's been practicing and he's been exceptionally doing well in his clinical practice since almost a decade. He's the elected member of Karnataka Board of Homeopathic System of Medicine in 2012 and known to be the youngest member of the board till now. And he has served as secretary and he's serving as vice president of Karnataka Qualified Homeopathic Doctors Association. He's a farmer's assistant professor in Department of Physiology and Biochemistry in Rosie Royals Homeopathy Medical College and Hospital, Bangalore. So I think we're all ready to listen to you, Dr. Chiranth. You can go ahead with your presentation.
Thank you. Thank you very much, Dr. Shilpa, for your introduction. A very good afternoon to everybody. I would like to thank our president, patron, and our chairman, sir, for giving me this wonderful opportunity to share my clinical experiences on our, my own association platform. Thank you very much, sir. And I apologize for missing the last month's CME due to the last minute changes. So, let us get into today's actual topic. Today's topic is efficacy of homeopathy in varieties of cases. We have seen our two different speakers who have given their own experience, clinical experience to us with varieties of cases from infertility to silolithiasis, glandular affections. So as homeopaths, we cannot put a boundary around us. Like I am a dermatologist, specialist in skin, specialist for endocrinology or diabetes or hypertension. So we cannot put boundaries around ourselves and start reading only one set of or particular type of cases, though we are having some expertise in some field. So as homeopaths, whether it is BHMS or MD, whoever it is, we need to explore ourselves. We need to explore the remedies, their efficacies in various cases. The college gives us the tools, the basic tools. We may get opportunity to work under some doctor who is practicing efficiently. So that gives you the next level of tools. And when you sit in your own clinics, that is where the real talent of a doctor, as it is described, homeopathy is not just a science, it is art and science, where the real talent of the physician is shown. So with this, let us start the presentation. By paying tribute to the founder of homeopathy, Dr. CFS Hahnemann, and salute to all the teachers who have given me confidence in practicing homeopathy and for my success today. So let me start with the first case of a male who is 60-year-old, who is a laborer. He works for a construction place. He's from a village called Kortegere. He visits me on 15th of April of the same year. And presenting complaint, more than theories, today we will talk something about some practicality in the clinic. So when we come to the presenting complaint, this is how he presented to me. And you can just imagine the depth of pathology. This is the other view of the same wound. So he's presenting with a non-healing ulcer, which is progressing in its dimensions in the right foot since 3 months. So for the past 3 years, he was diabetic and he was very careless. He was not taking the medication properly, whatever allopathic medication he was taking. He took it for a few days and then he stopped it on his own. He was not listening to anybody. He was a very egoistic person, first, basically. So he neglected that, and the ulcer in the right foot, it started putrefying and increasing. So when it developed to this point, then the wound debridement was done. Specifically, there was no pain or burning in the ulcer. When we talk about the past history, especially when the villagers come to us, it will be more challenging because like the educated class of people, they will not describe you their symptoms properly is one thing. And when we talk about the life space investigation or their desires, aversions, whatever it is, it will not be very clear. For example, if you ask the desire or aversion in that case for any villager, one common general thing what they say is mudde saru. Em tumba ishta mudde saru. This is their common reply. It will be very challenging to take such cases, first of all. So there was no specific thing in past history except for the weakness when he was diagnosed for the diabetes. Father, there was nothing specific in family history, and mother was asthmatic and his daughter has a polio attack. So I just started taking few details regarding his state of mind, where his son, he described that he was very obstinate. He doesn't listen to the family members' advice, or but he will just trust others and do good for them, but not for the family. Anger, it was shown on wife shouts. Earlier, he had rage very aggressively. He used to express his anger. But in general, he had no worries about health. He was careless. Later, after this pathology developed so much and the wound debridement was done, after seeing this state of his foot, he was a little worried about his health and he was having loss of sleep thinking of this. And what about the daughters-in-law? He has two daughters-in-law, and as usual, they may not look after him properly, and he has some worries regarding that, which is a common family problem now. And he was little sympathetic for others. So this is the few things. These are the few things which I've got out of his mind. There were no specific fears. And when we digged into the personal history, he had habits. He says BD before marriage, but by his profession, we cannot trust this symptom, but we have taken it down as he has told. Desires mutton, chicken, and peanuts. There were no specific aversions as such. His appetite was good, especially after surgery. He was craving for more food. Probably it may be a side-by-side symptom for his diabetic state. And he was more thirsty also, and sleep was good. But after this wound debridement, there was some disturbance in his sleep because of these thoughts. There were no specific dreams. And regarding the specific taste-wise desire, he had 2+ sweet, spice, coffee, omelette, banana, jackfruit, mango, and non-veg, as it is mentioned before. And thermally, he was towards both the extremes. He is hot and chilly. And his stools were regular, urination frequent, and perspiration is offensive throughout the body, more in the scalp and cervical region. So we just get one, as practitioners who have practiced for a few years, when we take the history of a case, we generally get few set of remedies in mind. So now you have seen the progression of the pathology and the present state of the foot. And we have seen the case. What do we expect now? How do we approach this case? If somebody can write on the chat box, it will be nice to have some sort of interaction with the participants. Can we think of at this point of time? Some are saying sepia, pulsatilla. Oh, this was the previous thing. Silesia, good. Opium. Should sulfur. Good, very good. So basically different types of practitioners. There are acetic acid is coming up. Yes, there are varieties of practitioners who practice argentum nitricum, graphitis, anacardium, acid, fluor. Very good. This is how we go with the case. Practitioners practice on pathology basis, specific pathologies. They have some set of remedies. They differentiate it and give it. Some think more of mind, his disposition, including with the personal history. They make a totality out of it and then they prescribe it. So there are varieties of approaches based on these symptoms. What we are getting from these symptoms, some are valid, some are not valid. Though we take 1 hour of history, most of the symptoms may not be valid except for the few. So after the entire history is taken, if you are thinking, for example, if you just check in the repertory, gangrene, we have the leading remedies: arsenicum, carbon animalis, carbon veg, China, Crotalus horridus, Helonius, lachesis, madorinum, phosphorus, plumbum, Cor, veratrum. And when you specifically think of the diabetic, again, here we have the carbolic acid, conium, lachesis. So these are the various remedies which are prescribed in the repertory. But we have few symptoms of mind also, and we can think of making a totality in this case. So we do not think of a pathological kind of prescription. The remedy may include gangrene in its spectrum or may not. Like there was a case which I presented previously of gangrene in the toe from Kolegala, a lady, where calcarea carb was prescribed. If you check in gangrene, the calcarea carb is not given, but still it got cured within 3 days, almost 80%, 70 to 80%. 6th day, it was completely healed. So if we are able to make totality out of whatever symptoms we are getting from the patient, so that should do wonders. So here we have mind, egotism, sympathetic, rage, anxiety about health after this debridement. This is the present state, what we have, the altered disposition or altered state of mind, if we consider it as. He's thirsty, desire sweet. He has burning in the foot, hands in the night. This was a confirmatory symptom. Like I asked, what sort of remedies you get at the end of case taking? This was a confirmatory symptom. When I asked him specifically about it, he said yes. The ulcer has no symptoms, but in general, he has burning in the palms and soles. And as a general rubric, I have taken gangrene and side right. This repertorization chart was made just to show it to the participants. But after the case taking, it was directly prescribed on the totality. So what are the leading remedies over here? If we see, it is calcarea, lyco, lachesis, sulfur, phosphorus, murk, arsenicum, naxvomica, natramium. So when we think of these things, when we consider his level of ego, burning in the palms and soles, desire, sweet, we get again, we have lycopodium here, we have naxvomica here. All these are egoistic. But lyco should cover specific type of thirst, and there should be a little bit of cowardice kind of element. So when we study the remedy, we should understand the essence of each individual remedy. Like calcarea, it has its own trait. Lycopodium, it has its own trait. Phosphorus, it has its own trait. Though clinically, all the basic symptoms what the patient gives will lead you towards these remedies, and they all run parallelly. But as a clinician, you need to differentiate very minutely and arrive at a remedy. So after this case taking, sulfur 200 TID was prescribed for the patient for 3 days and SL for 3 days alternately. So specifically in case of gangrene, what I expect out of all these cases, what I've seen is we should have a positive result within 2 or 3 days. Every second day or every third day, if we are asking him to change the dressing of the wound, with the next consecutive dressing, if it is second day or third day, the patient should say he has seen the new granulation tissue. And 15th, I had prescribed him sulfur 3 days followed by PL. The first photo is how it was when he came to me. And if you see the next thing, you can see all that black discoloration, what you have seen in the foot is not there. And you can see the bulge in the granulation tissue. This is one view. This is another view. If you can see, you can make out the difference, like how the granulation tissue is growing. So he was advised to continue the same way, 3 days plus 3 days, sulfur plus SL. And this is what we see on 25th of April. He came to me on 15th. This is on 25th. You can see more pinkish tissues and it is bulging out. So the remedy what we are with is correct according to this present situation. We need to be very careful because last time I had shown a case of gangrene where arsenicum was prescribed and there was auto imputation of the toes, 3 toes which were dark. I have also seen cases of gangrene. If you take a wrong step in deciding the remedy, it can just collapse the case and the life. It can threaten the life also. After 25th, this is the next photo on 1st of May. So the medicine was over and it was continued the same way. And once the healing is done, it is very difficult to get our patients back. We need to go behind them. They were lost. And after so much of struggle, yesterday I got the next photo of this, the present. They were saying it is healing, and medicine was sent by courier. And if you can see the yesterday's photo, it is 4/9, sorry. This is the level of this granulation tissue which has healed and his limb is saved. Or else it would have directly been, they have advised to amputate the lower limb up till knee, because the pathology will progress much. So we have reversed the pathology and saved the limb of this patient. And we have given a new life for him. So this is how the remedies make wonders when it is rightly prescribed. I have one more case here of a lady who is 38-year-old housewife from Nalmangla. For the past 2 months, she has come to me with the reports. There are people who come with symptoms, we have to diagnose. There are set of patients who come with reports with their diagnosis. So she was a known case of hyperthyroid since 2 months. She was losing weight since 5 months, because of which she has checked her thyroid profile. Weakness is felt in general, and she was already under medication of 10 mcg of carbamazole with reduction in the levels of hemoglobin. And she had headache since 14 years, which was on and off, which was better with the painkillers and increased with the sun. Since then, she is avoiding sun and she is avoiding her headaches. Left-sided headache seen now and then, no specific modalities as such. And if you look at her reports, it is 9.1 hemoglobin. And if you look at her thyroid profile, it was 2.47. According to this lab, it is up to 2, it is normal. It is 2.47 T3 and 12.5 is the limit for the T4 and it is 13.99. TSH is 0.005, less than 0.005. So she was under medication. When you consider her past history, 2 months ago, she had some fever and she had hemorrhoids 15 years back during pregnancy. And both the deliveries were LSCS, cesarean section. And she had UTI once during pregnancy, sun headache since 14 years. Father diabetic, mother nothing specific. And if you consider her mind, earlier she was very silent, good at studies, anger tendency nowadays. She speaks more, consolation, desire, and amelioration. See, every symptom patient gives, we start getting the remedies. Let us keep it in our mind. Shares if other person listens, worried about some financial matters. She is sensitive and she weeps easily. She has specific fear of dark, being alone, high places, water, thunder, and dogs mainly. And she has anxiety with sudden moves, like somebody comes suddenly, she has to face somebody suddenly. Desire for homemade food. She's thirsty, appetite is good, sleeps late, fearful, dreams, she has nightmares, and snakes. Salt 2+, sweet 2+, spice 2+, lemons 1+, bananas, oranges, ghee. These were her specific desires. And thermally she is hot and she has perspiration over the face and cervical region. Can you just quickly, a few of you, tell some remedies? Can somebody say?
Sir, lachesis.
Okay.
There's
You can just
natmine,
type, you can
pulsatilla,
type on the,
phosphorus. These are the remedies in the chat.
yeah. You can type in the chat box. So this case was taken into the repertory and you see phosphorus, sulfur, natrum, tuberculinum, madorinum, stramonium, calcarea, causticum, all these things. And this also was not repertorized directly with the case taking and the specific highlights of this remedy. When we study the essence of the remedy, that's what I was talking. When you read the remedies with their essence, there is one specific book also called as Essence of Materia Medica by Professor George Vithalkas. When you read the remedies, every remedy will have its own trait. See, cough, almost all the remedies have. Fever, every remedy has. Specific desires and aversions, whatever it is there, every individual remedy has some highlights. So when we get to know that essence of that remedy, we can prescribe easily just with the case taking. Not always the repertory is required unless and until we are very clear about the remedies. So stramonium 1 MOD 3 doses were given. See, we have the specific element of terror in her. She has nightmares. She has very strong fear for water, being alone in dark, fear of dark, and she is nowadays aggressive. So anger element, fears, all set of fears. If we go through that remedy, we will understand that remedy. That was given 1 MOD 3 doses. And she comes back on 11th of November and now she says she's not getting headaches. And only after a long journey, she had the headache. Weakness is better. She is doing well. Cold and cough with frontal headache since 2 days. She was exposed to the cold air and she is chilly. She has clean tongue. So obviously with this acute presenting complaint, we will give the acute remedy. Arsenicum album 200, SOS 5 doses were given, followed by PL. Emergency, if she wanted, she had to take it. And you see the next report, what she gets in the next follow-up on 16th of December. Her hemoglobin, if you remember, it was 9.1. And if you check it now, it is 13.5. She has not taken any of the iron supplements. And you check this TSH, it is 0.18. It is increasing, but keep in mind, she is also taking parallelly the carbamazole, 10 mcg. And later on 1610, with this report, she comes and she says HB is 13. Earlier, it used to be 8 or 9. And she says a new symptom that her melasma is reducing. Okay. And now she has no fears, anxieties, and palpitations now. Anger, yes, anger is still there. And she has one new symptom now. Please be careful when you're taking the follow-ups, because you should know when to change the remedy. Should you change? Should you not? You have to decide it. So she has gastric complaints like heartburn on skipping meals and spicy food. And it is ameliorated by warm water. She takes warm water to ameliorate. And thermally, she is hot, and she has a specific desire for sweets now with profuse perspiration. So we have started the case with a remedy. She is doing well. We can wait. We have waited for 2 follow-ups. After that, we have this after arsenicum album. So when we have specific symptoms, if you put this into repertory, it comes, lycopodium comes up. So 1 dose of lycopodium was given, followed by 15 days of PL. This was in 1610, followed by PL in between, every 15 days, 1 month. And in January, she comes and she says she's doing well. She had been to a Ahobala trip, but she never had strain. Earlier, she had weakness in general with general daily activities. Now she goes for a trip of Ahobala and she has no strain, she says. She says her melasma, it is only 30% of it is remaining. And no tablets were taken for body pains or headache till now, since our treatment. There is no episode of anxiety or panic attacks, and PL was continued now. You see, suddenly in the next follow-up on 10/3, she comes with 24.91 TSH. Everybody is shocked, the patient and the doctor both. And when we just looked into it, she says she's still continuing that carbamazole with the treatment what she's taking here. And she was asked to stop it immediately, as it is 24.91, and PL was continued. Later, there was a COVID case in her family, and she had taken that case to hospital everywhere. She had roamed with that. And she had some acute symptoms in 17/4, for which arsenicum album was given SOS. And allopathic, she has already stopped in the previous follow-up in 10th of March. So she has stopped completely. And there is one more acute prescription. Just after 17th, she comes back on 25th. She says bitter taste is reduced in the mouth, but weakness is still more. Taste is getting better. There is no frontal headache, but now she is having feeling like having juices. That is the desire. Her appetite is good and spicy. Can we just think of another remedy here? She's getting better, but acutes, we need much faster improvement. We should expect 17, and it is 25th. So she has a new desire over here, and she says it is weakness, which is more, for which acid first was given SOS. TID 1 or 2 days, you take it. After you feel better, you can stop it. That was the advice given to her. And she checks her hemoglobin again on 23rd of May. It is still 13.3. She's very happy. Earlier, it used to be always 8.9, 8.9 for the past few years. And you see, after stopping of allopathic remedies in March, after 2 months, by the end of 2 months, it is almost towards the 3rd month, her TSH is still 1.77. No fresh complaints. She has completely stopped allopathic medicines in March itself. So again, she was asked to check her TSH. It is still 2.16 in 11/7, July. So after 4 months of stopping the carbamazole, whatever she was taking, and there is no panic attack and betterment in her weakness, everything in between, there are a few acute prescriptions, and 2.16 is the present TSH value, and we have stopped the medication to her because we have waited for 3 to 4 months, more than 4 months after stopping allopathy, and still it is not reducing. From 1, it has reduced, it has increased to 2.16. So that is a clear indication that she is, yes, back to normal. So that is how we have reversed the pathology. So we are getting late. So these are the 2 short acute cases which I have to tell. This is a case of COVID with a score of 21/25. If you count it, it is almost 84% of the lungs which are infected, which are affected. And this was a case where I had an opportunity to treat, because if such cases are in ICU, we will never have an opportunity to just interact with the case also. But it was in a government hospital in my place. So the patient had his choice to take homeopathy. And this case was advised to shift to hospital with ICU, and no hopes were given by the doctors. Only it is percentage. If you see percentage, it is 5 days. They gave only 5 days this man will survive with 21 out of 25 score. And anyway, we have not seen the patient. All that we have to decide is only with the information given by the bystanders and over phone call of this person. If you check this CT scan report, it is 21 out of 25 total score. On 3rd of May, this scan was done. So these were the complaints. With oxygen, it was 80. Without, it was 60. The saturation, SpO2. With oxygen, it is 80, and without, it is 60, and it is always fluctuating towards 60, 65, like that. And he will be very weak when he goes and comes to the bathroom. Breathlessness 3+, least moment aggravation. Please think of all the remedies with every single symptom you see, because we cannot have a detailed history taking LSI, whatever it is, as we do with our regular cases. This is a case of COVID. We have to have a very quick analysis and quick prescription with everyday improvement in the case. That is what we expect in such cases. And he had a very severe difficulty in lying down. He always wanted to sit up, can't chew the food. He could take only a little bit of ganji and up it, that's all. That too with very difficulty. And chills, no heat. He had chills before and no heat. Perspiration of the scalp, cervical region and face. Mouth feels salty. If you consider all these things and put it into the repertorization, you should get your acute remedy. And he's taking juices, but little. Water, not able to drink. But he's taking only little bit of juice. Please keep all these things in mind. And these are in general desires like chitrana, chicken, all those things when he was normal. And now he's taking warm drinks, which makes him feel little better. So we have a collection of various symptoms which indicates different remedies, and acute you need to be very careful. So he was chilly and alternate day stools, and he used to sweat while eating. And all these things were put, you see ars, you see lycopodium, you see calcarea, sulfur, pulsatilla, silicea. And with this, you also have one specific symptom which says he takes juices, not water. And arsenicum also, yes, takes fruits and juices, but this is a case with only 5 days of hope. And this is a case which needs a different type of approach, for which I thought to save this case at any cost. I prescribed him arsenicum album 200 QID 4 times a day. And in between, he had least aggravation exertion of his breathlessness, which is a direct keynote in Stana Metallicum. Please go back and review the remedy. That was given in between 4 doses of R-salt in between Stanomet, 1 dose, 1 dose, 1 dose, 3 times in between arsenicum album. This was given, and this case was presented in GHMC last time, and I had shown you the audio call of that lady who was the wife of the patient, and she describes it very well. Oxygen raised to 80 without oxygen support, which was 60 on the previous day. Just one day from 60 to 80, the oxygen level has raised, and food intake is good. He is able to take liquids freely, even the ganji, water, whatever it is. He used to refuse it. He used to take a little bit. But within one day, this is the level of improvement, and he feels better with his energy levels. And I said, okay, you please continue the same way. 4 doses of arsenicum album with Stanomet. So that was on 5th and 6th. Now 10th of May. He has a different, all those medicines what I had given were over. Now he has a set of symptoms. Left leg pain, he took Chitrana. He was able to eat food now. He also asked for Uppitu. He is asking, he had too much of craving, ravenous appetite, what we take as a repertorial rubric. That was seen in this person. He was not at all eating for the past 10-12 days. Now he is asking, every 1 hour he is feeling hungry, he is taking food. And breathlessness is ameliorated. Since yesterday he is doing very well. There is no exertional dyspnea, inarticulate, so he was not able to talk properly, straining on speaking. He drinks water, warm, but not too hot. Doesn't cover in the night. Please be careful. We have given arsenicum album. He was chilly, and now he says he doesn't cover in the night. There is perspiration. He wants fanning. So we can see the change in the thermal from chilly towards hot. Please keep in mind for deciding the next remedy. And taste, he feels, he's able to feel that spiciness of the food, which had lost before. In the food, only the spicy he's feeling now, and still other types of tastes are bland. Without oxygen feels weak. There is no brownish expectoration. Earlier, I will just play one short clip for just few seconds of what the patient has described. I'll show you later after this. With this set of symptoms, I have given him Bryonia TID 1 gram followed by Carbovich 200. We are not mixing the medicine, we are giving alternately. And if you check, go back to Boric and check the remedies that follow well Bryonia, you have Carbovich. We have the symptom of wanting fan. Thermals is changed from chilly to hot. And he has some pains also in the extremities. So Bryonia alternating with Carbovich, 1 hour before, 1 hour after. And in the noon also, 1 hour before, 1 hour after. This was continued. And you see that on 19th, we have the follow-up. This was done on the 10th. 19th, another CT was done. And the score is 18 out of 25. And he's doing well, able to withdraw oxygen for half an hour. He's able to withdraw and stay stable. This is the CT scan report, which was done for the second time. Earlier, it was 21 by 25. Now you see the total score over here is, it is 18. And the patient speaks now. He has come to the clinic.
ನನಗೆ ಒಂದು ಬದಲಾವಣೆ ಏನು ಅಂತಂದ್ರೆ ಅದಕ್ಕಿಂತ ಮುಂಚೆ ನಾನೇನು ಮಾತ್ರೆ ತಗೊಂಡಲ್ಲ ಕೊಟ್ಟಿದ್ದೆ.
It's not aware of anything except for the blood-like expectoration. I was confused if it is blood or it is mucus. That is what he describes. As clinicians, we understand it, but as a person who is suffering, he knows the pain, what he has gone through. And his wife says, yes, from 60 to 80 within 1 day, it raised. And we have saved this life of this person who was having only 5 days of life expectancy. He's doing well now. So this will be my last case, and I will be closing it. This is one more case of COVID, but it is post-vaccination. Post-vaccination, 65-year-old lady, she fell ill after second dose of vaccination and was asked to just wait. They went to the hospital. They said, no, you have taken vaccine. You just wait. Now we'll not give you any medicine. And after a week, they went to a different private setup. And they just did the CT and the score was 32 out of 40, which amounts to 80% of lung affections. And they said, why you came so late? You should have come early. One person says, we'll not treat you. Another person says, you are late. Where should the patient go? 65-year-old lady. They're not well off to do. And you see the CT scan report over here, 32 and out of 40. And they were referred to the higher center. This hospital could not give them bed. So again, a quick short analysis of this case. Weakness, not able to take food. Cough is very much more in since one day. There is bitter taste in the mouth, nausea while looking at the food, vomiting, eating after. She is not able to retain whatever she has eaten. And she has taken twice nebulization yesterday. She is breathless. 70 to 80 was the saturation. Weakness while coming back from bathroom. This is a common symptom of all these COVID cases, if you have seen. Expectoration seen reddish. It is the similar condition where 80% of lungs is affected. She is chills sometimes. She removes of covering sometimes. There is alternating. And she is mourning with that whatever state she is in. And today she has loose stools. She's anxious to news, all the media talking about COVID, and she is very much worried about that also. Any news of accident, she's worried. She's having fear to see injuries. So this was her state of mind in general. And she's hungry but not able to eat food. She's thirstless. She takes warm drinks, but little quantities. Chilly and hot alternate. Stools on alternate days. She was prescribed arsenicum album 1 gram and emergency acid phos was given for her weakness. Though Arsal was given, this was given as SOS whenever she feels so weak, because this is a very progressed pathological condition where we cannot take chance. We cannot wait for a very long time and we need to give quick reactions. And later this was prescribed on 18/5 and 6/6. You just see, these are the symptoms. Food, she is not able to taste the food still. She has cough, but there is no vomiting. Cough is seen. And every time she ate something, she used to vomit it. That has stopped first. And loose stools has stopped first. And now she is able to walk alone. She's able to get up and she's able to walk within house itself alone. In between, it had stopped and again she has loose stools. Taste is still not felt. Again, the same medicine was repeated for her. And the CT scan was done. You see the total score. Earlier it was 32 out of 40. You see it is 15 on 7th of June. And we have saved the life of this case also. So does it mean for all the cases we should give arsenicum album or what? We have all these remedies which are indicated: Drosera, Bryonia, Rumex, Phosphorus, Calcarea, Carb, Rustox has been given, acid phos, Naxvomica, Gelsemium. All these cases, all these remedies are given. And are we giving combination for all the cases? No. Out of 135 plus tested positive cases in my clinic, these are the few cases which I have shown with too much of severity in the CT score. And all other cases, single remedy, just few doses. And this is one of my junior doctor, 5 cases in same family. Next day, first day of the prescription itself, she says my cough is 50% better, mom is 50% better. So this is the with single remedy, just 2-3 doses in one day. The next day, this was the case. And this is in the end, you see, we all are much better now. Thank you for the timely support. So these people from 20-25 days, they were coughing. That was the intensity of the symptom. They are better with our medicine in just one day and followed by few doses within 3 days, 5 days. One got better in 3 days, one got better in 5 days, one took a week. All 5 people got 5 different remedies. And I have one more doctor, both husband and wife, they started with symptoms and they have given for RT-PCR. and they want treatment now. So the remedy was prescribed. Next day, wife says, I'm 90% better. And husband, he was interfering. Every time he used to get fever, he used to go take Dolo, and the fever was prolonged next day. But still, he was able to take water more. His appetite was improving. Wife, first day itself 90% better, and she got better in 2-3 days. Both the kids, they had minute symptoms. With ourselves, they were better. And after 3 days, they get the report as positive. They don't know. They get the report, by then they're all doing well. So they were cured before the remedy, before the RT-PCR result came. This was one more case of a brother of one more doctor friend of mine. He had lost hopes in homeopathy for many years with various bad experiences, and he was not ready to take homeopathy. But he got COVID, and this is the review what he has written. I was cured of my COVID issues within 2 to 3 days. The person who has lost hope in homeopathy comes back, takes homeopathy, and he gets the result. That is the effect of right prescription. And for more cases which are cured with single dose, repeated doses, pathological prescriptions with progress pathologies, you can take screenshot of this and you can visit that on YouTube. Thank you very much. Thank you all for giving me this wonderful opportunity, sir, for